Iron is a mineral that plays a very crucial role in the production of red blood cells. It is important to note that the body requires iron to produce hemoglobin, which is a protein within red blood cells that helps facilitate the transfer of oxygen and carbon dioxide between the lungs and other tissues and organs within the body. Iron deficiency is the most common type of anemia, and this occurs when your body does not have enough of the mineral iron. I am the Doc, and in this video we'll look at those that are most at risk of developing iron deficiency anemia, as well as some of the common signs and symptoms that you need to look out for. So, let's go. Basically, you're at the risk of developing iron deficiency anemia if you do not get enough iron from your diet, if you are unable to absorb enough iron from the food you eat, or in cases of increased loss of iron, for example, when you bleed or have excessive blood loss. People at risk of iron deficiency include women of childbearing age who are having heavy menstrual periods, also pregnant women, infants and young children. You have individuals that donate blood very frequently, and also in some cases vegetarians that fail to replace meats with iron-rich substitutes. If you realize that you're at high risk of developing iron deficiency, it is important to talk to your doctor, as you might benefit from blood tests and also some changes to your diet that can actually benefit you in the long run. So the very first symptom of a true iron deficiency is unusual tiredness or fatigue. Feeling very tired is one of the most common symptoms of iron deficiency, and this occurs when your body is unable to have enough iron present to produce hemoglobin, which carries oxygen around your body to all the various tissues and organs. Without hemoglobin, we should understand that less oxygen reaches your tissues and your muscles, hence depriving them of energy. That's why you can feel tired. You should also realize that your heart will be working overtime, trying to pump out oxygen-rich blood to supply these tissues and organs, hence depriving you further of more energy and making you feel very, very tired. You should note that feeling tired and fatigue can be very non-specific. In other words, it can appear with other medical problems, but it is very common with iron deficiency anemia alongside other symptoms like feeling very cranky and also having very poor concentration. The second on the list is pale skin. Pale skin or pale colored mucosa inside of the lower eyelids are actually commonly associated with iron deficiency anemia. The red color of red blood cells is actually due to the hemoglobin within the red blood cells. So when you have low iron leading to low hemoglobin levels, that would make the red blood cells less red and more pink. Other parts of the body that could be pale, just like the inside of the lower eyelids, include the face, the gum, the nails, and actually the inside of your lips. This is actually one of the first things that the doctors check when they examine you. If you come in with complaints that are concerning for iron deficiency, they check the lower eyelid, check your mucosa to see if you look pale. And usually after this, they can order a blood test to confirm the diagnosis. It is important to note that in people of dark skin or darker color, a pale inner lower eyelid might be the only place where you can actually notice the paleness. Number 3, glossitis and mouth ulcers. So glossitis is a term that is used to describe an inflamed tongue. The tongue could be red, swollen, and such that the bumps that you normally find on the surface of the tongue actually that contain the taste buds look stretched out and they disappear. Sometimes just staring inside your mouth or around your mouth can help you indicate if you have iron deficiency or not. You might have a dry mouth or a burning sensation in your mouth. Sometimes you have cracks at the edges of your mouth, and also in some cases develop mouth ulcers. Fourth on the list is restless legs. This is a very strong urge for you to move your legs at rest. It is a very unpleasant, strange sensation, crawling-like sensation, or even itchy sensation within your feet and your legs. And the worst part about it is that it is worse at night and can make it very difficult for you to fall asleep. A good percentage of people that have iron deficiency anemia actually have restless leg syndrome. And when compared to the general population, the prevalence of restless leg syndrome amongst those individuals with iron deficiency anemia is actually higher. Number 4 is shortness of breath. Like we've said earlier, hemoglobin helps carry oxygen around your body to your various organs and tissues. So if you have a low hemoglobin level due to the fact that you're iron deficient, that leads to low oxygen availability to your organs and tissues, such that your regular physical activities like walking, climbing the stairs, things that are normal to you, and not stressful at all become more strenuous. You find yourself having to catch your breath or breathing very fast with minimal activity, and this is due to your body trying to get as much oxygen from the environment as possible, and in that process you can actually feel short of breath. Finally, the fifth on the list is what we call strange cravings, which is very interesting. There is a word called pica, which means craving strange foods or non-food items like ice, clay, dirt, chalk, or even paper. It's actually strange, but it is seen in individuals with iron deficiency anemia and also in individuals that are pregnant. Other possible symptoms seen in iron deficiency include headaches, dizziness, increased irritability, in other words, you're very irritable, depression, you can have cold hands and feet, or very dry or damaged hair and skin, and in some severe cases, some individuals have nails that are spoon-shaped, but this is usually seen in severe cases of iron deficiency. If you think you're showing any of the symptoms listed above, or you have concerns about being iron deficient, it is very important that you talk to your healthcare provider regarding your concerns. In fact, for most people, iron deficiency can be prevented just by having an adequate iron-rich diet. But if despite an adequate diet, you still have iron deficiency, then you might have to be placed on iron supplements. Try to ensure that you get enough iron through real food in your diet. Only take supplements if recommended by your healthcare provider, which could be your doctor or your nurse. The main aim of treating iron deficiency anemia is to help restore your hemoglobin levels to normal, as well as to replenish the iron stores within your body. Finally, we've come to the end of this video. Thanks for watching. Make sure you give this video a thumbs up if you found it informative, and do not forget to subscribe to the YouTube channel by hitting the red subscribe button below this video. Also hit the notification bell to be told about future videos. Hope you have an awesome day. Stay safe. I'm the WizDoc. I'll see you soon. Bye.